Welcome to Medically Speaking. Our guest today is Dr. Paul Shields, the Chief Executive Officer and the Chief Medical Officer of Great Lakes Health Integrated Network. Doc, thanks for joining us today.
Good morning. Thanks for having me.
So if we can, let's start out, talk a little bit about what Great Lakes Integrated Network is for the viewers who may not be familiar with the organization. So tell us a little bit about who you guys are.
Yeah, thanks. So Great Lakes Integrated Network is a collection of about 900 providers across 58 different practices in Western New York. We have come together as a collective clinically integrated network focused on three real common goals of all of our partners: enhancing the patient experience, improving population health across Western New York, and lowering the total cost of care by better outcomes and improved efficiency.
Got it. So if I'm a patient and my doctor's with the Buffalo Medical Group or one of the smaller, primary care practices, this is those practices coming together in a collaboration to help with outcomes. Is that correct?
It is. It allows practices who want to remain independent in practice come together and share resources across, so that things like centralized care or care management, streamlined workflows and processes around chronic conditions such as diabetes or hypertension can be standardized, so that if you're in a single doctor office, you get the same level of care matching national standards that maybe a large group of 30 or 40 providers would be able to provide.
And for Western New York, the average healthcare consumer probably doesn't realize this type of work that's going on, because it's kind of almost behind the scenes. It's almost like the intra-physician community. But why is this so important? And you mentioned some of the services, but talk about why it's so important and what are some of the things that you guys do to help physicians help patients?
Yeah, it's so important because there is a sense, healthcare is patient-centric at its very heart. And there is a lot of overlying pressures at the national level, at the state level, even at the local level, that some entities are going to, quote, fix healthcare. But the challenge in that is fixing healthcare comes to the provider and the patient. That relationship of where that care is delivered is really where the changes need to happen. And if we don't involve and engage those providers who are delivering the care, we're never going to get to it. We've seen this across the last 10 to 15 years, where health insurance companies or governmental agencies will pass an edict of X should happen and Y will occur, and healthcare will be better. Miraculously, we'll fix it because somebody that isn't providing care has decided that's the way it should be. And that just hasn't worked. I mean, it has not shown outcomes. And that's why we're here today. It's why we're coming together as a collective, because the change in outcomes, the change in patient experience is at that provider level. And this of coming together allows not only that collaboration without having to purchase a practice or employ a doctor, it allows them to maintain their autonomy and control, but it allows them to then tap into the resources of things like centralized care management. So if a patient has ever had the unfortunate experience of needing healthcare, and this is across the country, it is not easy to navigate. It's easy to get to that first visit, right? You show up in an emergency room, you show up at your primary care doctor. That's relatively easy. The problem is 90% of first encounters turn into at least 2 more encounters. And then navigating that becomes very challenging. So a private office that has somebody checking patients in, maybe somebody rooming a patient, and then a provider, they can't hire another full-time person to help those patients navigate. If we bring everybody together, now we have the ability with care navigation and care coordination to help a patient make their cardiology appointment, make their pulmonology appointment, get them their radiology that they might need from an imaging standpoint, and assist them in getting to that care that they need that wouldn't otherwise be available in a private practice.
You use the term patient-centric, so let's stick to that for a second. So if, like I mentioned earlier, if you're a patient and your practice is in, your doctor's in Orchard Park or Williamsville, how do they engage with GLIN directly? Do they reach out to you guys individually, or are they directed by their primary care docs?
So there's a couple of options. So we do have a website, glin.com, that patients can go on. And one of the reasons they would go on there is if somebody at some encounter said, you should see cardiology, or you should see pulmonology, or you should do X. we have a directories tab on our website that will allow them to navigate to those specialties and those providers that are part of their network with their primary care doctor. So that would be a self kind of navigation to it. We have a telephone contact for patients who like to still use the telephone, 716-800-CARE. Patient can call and choose the appropriate option. For most patients, it's going to be option 3, care management, and they can direct them around that. They can be referred by their primary care doctor, somebody who the primary care doctor says, you have a lot going on. You've got some other issues that aren't necessarily medically related. I'd like you to get involved with our care management team. And that referral could happen. And then a care management member may reach out to the patient around how they can assist them. The other way to do it is that we may identify through looking at our data and analytics and understanding a patient's profile that they could benefit from some of the services that we have. And in that case, they may receive a call from one of the care members at GLIN asking them if there's any way they could support them with the challenges that they may be experiencing.
Very, very, very helpful. What if my primary care provider is not part of the network? What do they do then?
Yeah, and they have 2 options there. They can encourage their primary care doctor to reach out to GLIN, glin.com, or through the telephone number, and we would love to have a conversation with any physician who wants to better the healthcare in Western New York. The other option is they can go on the website and look at the primary care doctors that are part of the network today, and they can make the decision if they would want to have their care transferred to a primary care physician who is already part of the network. But we are always willing to entertain conversations with primary care doctors about how we work better together. I like to say we're not competing today. We all just need to perform. And as we perform, we will all do better. So coming away from this idea that there's 2 sides on the fence, I think we can all just work on total performance improvement.
So as we wrap up, I'll ask you the last question. You talked about your excitement for the future and what this could look like and what Western New York healthcare delivery can look like. Tell us more about that. What project or initiative or, what is the vision that you see when you look out, the next year, 2 or 3?
Internally, really building that care management structure. We're scaling that. We're bringing more staff on a regular basis to meet the needs of our population. So getting really focused on complex chronic illness, diabetes, hypertension, heart disease. Those are prevalent in our community. And we really want to scale and optimize those programs. Care navigation around patients who are high risk. So you have a hospital stay, you have multiple hospital stays, you have multiple conditions. We want to get you a designated person that can help you navigate that journey. I think the most exciting piece is, as we've shown value in the work that we do by coming together and not competing but performing, payers are wanting to partner better. So rather than just sharing data in a time-limited fashion or with some lag, really working cooperatively to get to the point where we all get to that same end point of better care for patients. I think the coming years are going to see a much more cooperative and collaborative relationship as opposed to this payer-provider relationship that almost seems like they have different vision and mission. And really, we all have the same goal. We want better care for the patients, and we want to be in a model that is sustainable, right? We want everybody to kind of be able to continue to invest in programs and opportunities. So how do we get there? We get there together, and we do that by all performing well. And I think that's probably the most exciting piece that's coming out of it. We've had a lot more reception from payers in our local community about how do we partner better rather than using us as a vended solution, or they become a claims administrator, really working together.
Well, obviously very informative, but also very exciting to see where all this is going as you bring all these entities together. We appreciate your time today. Thanks for joining us on Medically Speaking.
Thank you.